If your hands go numb at night and you have to wake up to shake your fingers off to get some feeling back, or you're dropping your coffee cup a little bit more than usual and your grip feels kind of weaker than it used to be, you might think that you're just getting tired or getting old. But there's a good chance that you might be dealing with carpal tunnel syndrome. I'm Dr. Zikky. I'm a board-certified musculoskeletal radiologist. I see this condition constantly in my practice, and I'm going to break down all you need to know about carpal tunnel syndrome. After this video, you're going to know exactly what carpal tunnel syndrome is, why it happens, who's most at risk, and what actually works to fix it. All explained using plain English. Because if your hands go numb at night and you have to wake up to shake your fingers off to get some feeling back, or you're dropping your coffee cup a little bit more than usual and your grip feels kind of weaker than it used to be, you might think that you're just getting tired or getting old. But there's a good chance that you might be dealing with carpal tunnel syndrome. And here's the thing. Most people have heard about carpal tunnel syndrome, but very few actually understand what's happening inside of the wrist and why it gets worse at night, why it gets worse if you don't take care of it, and lots more about it. Right, so first things first, what is carpal tunnel syndrome? Picture your wrist as a tunnel, literally. Inside this tunnel, you've got 9 tendons running through there. Now, this help you bend your fingers and help you grip things. And right alongside those tendons, you have a very important nerve called the median nerve. This nerve is like an electrical cable running through your forearm all the way down to your hands. It gives feeling to your thumb, index finger, middle finger, and part of your ring finger. It also controls some of the small muscles at the base of your thumb. Here's where the problem starts. That tunnel is rigid. It's surrounded by wrist bones at the bottom and a thick ligament at the top of it called the transverse carpal ligament. So it doesn't stretch much. So if anything inside of this tunnel swells up even a little bit, the pressure inside increases significantly. And when that happens, the thing that gets squeezed the most is that median nerve. That squeezing of the median nerve, and then the symptoms that you get from that, the numbness, the tingling and pain, that's carpal tunnel syndrome. Think of it like running a garden hose through a tight pipe. If that pipe gets even slightly narrowed, the hose gets pinched and the water flow decreases. That's basically what's happening to your nerves. So what does carpal tunnel syndrome feel like? Most people would describe numbness and tingling in the thumb, index finger, middle finger, and part of the ring finger. It feels like pins and needles or like your hand wants to fall asleep. A lot of people notice that it's worse at night. You wake up around 2 to 3 a.m. and your hands go completely numb. You will have to shake it to get some feelings back in your finger. You might also notice that your grip strength has gotten weaker. You're dropping your phone, your coffee mug a little bit more than you used to in the past. But here's an important detail. Your pinky is not affected in carpal tunnel syndrome. Why is that? Because your pinky is controlled by a different nerve, the ulnar nerve, not the median nerve. So if your whole hand is numb, including your pinky, it's probably not carpal tunnel syndrome. You should be probably evaluated by other things, including the pinched nerve in your neck. But if it's just your thumb, index finger, middle finger, and sometimes part of your ring finger, that's classic for carpal tunnel syndrome. Why does carpal tunnel syndrome get worse at night? When you sleep, your wrist naturally goes into this bent position even without you realizing it. That bending increases the pressure within the carpal tunnel. So the more your wrist bends, the tighter it gets in that carpal tunnel and the worse your symptoms become. Also, when you lie down, fluid in your body shifts. Some of that fluid accumulates in your wrist, which increases the swelling around the median nerve. More swelling around the median nerve means more pressure around that nerve, which also means more symptoms. That's why so many people wake up at night and have to shake their hands off to get some feeling in those fingers. Shaking temporarily changes the pressure and improves blood flow into that nerve. But if you're waking up multiple times at night and doing this, your nerve is telling you that there's something wrong. Who gets carpal tunnel syndrome? Carpal tunnel syndrome is extremely common, and women are more affected than men, especially middle-aged women. Why is this? The size of the carpal tunnel in women is slightly smaller on average when compared to men. So less room within the carpal tunnel means that the pressure builds up faster. Also, hormonal changes during pregnancy or during menopause can cause fluid retention and make symptoms worse. Pregnancy is actually one of the biggest risk factors for carpal tunnel syndrome. A lot of pregnant women develop carpal tunnel syndrome in the 2nd or 3rd trimester. The good news is that pregnancy-related carpal tunnel syndrome usually improves after delivery. Other risk factors include systemic diseases like diabetes, thyroid problems, rheumatoid arthritis, obesity, previous wrist fractures, or jobs with repetitive hand and wrist motion. Now here's a big myth. The typing myth. Does typing cause carpal tunnel syndrome? The short answer is that typing alone does not directly cause carpal tunnel syndrome. Studies have looked at this, and there's no strong evidence that your keyboard by itself is a major cause of carpal tunnel syndrome. What can contribute to your symptoms are repetitive wrist strain combined with forceful gripping and vibration. So it's less about sitting at your desk and typing emails and more about using like power tools for hours in the assembly line. The real culprits are usually anatomy, hormones, and underlying health conditions like we talked about, like diabetes, thyroid problems, rheumatoid arthritis, not your keyboard. So what's actually happening to that nerve when it's getting compressed? When pressure builds up, a few things happen in different stages. Stage 1, the nerve gets irritated. You start feeling occasional tingling, especially at night. Stage 2, the blood flow in the nerve decreases. So the nerve struggles to send signals properly to your brain. Symptoms start happening more frequently. Stage 3, if the compression continues long enough, the nerve can become damaged. This is when you see the constant numbness, noticeable weakness in your thumb, and muscle wasting on the base of your thumb. Basically, this muscle looks kind of smaller when compared to the unaffected contralateral side or the unaffected side. That muscle area is called the thenar eminence. If you look at your hand and that area looks kind of sunken in compared to the unaffected side, that's a sign that the nerve has been compressed for a long time. That's a red flag, and you got to see a doctor very soon, because once that muscle starts wasting or becoming thinner, the recovery becomes a lot harder. But if you catch it early, the nerve can recover once the pressure is relieved. How is carpal tunnel syndrome diagnosed? Most of the time, it just starts with your symptoms and a physical examination done by your doctor. Your doctor would do a simple test. One of the tests is called the Tenniel's test. The tap over the nerve on your wrist. If that causes tingling in those fingers, it's a positive sign. Another is called the Felon's test or the Felon's maneuver. You press the back of your hands together with your wrist bent like this. Then you hold it for about a minute. If it causes numbness and tingling in those fingers, this is a positive sign as well for carpal tunnel syndrome. If the diagnosis is unclear still, your doctor might order a nerve conduction study. This measures how fast the electrical signals travel through the median nerve. If the signals are slowed down at the wrist, that confirms carpal tunnel syndrome. So it's a confirmatory test. Carpal tunnel syndrome is mainly diagnosed by physical examination and the history that you give the doctor. What happens if you ignore your carpal tunnel syndrome symptoms? Well, early on, the symptoms might come and go, but if the pressure continues, things get worse. Numbness becomes constant. The weakness gets worse. You start dropping things regularly. And eventually, you can develop permanent nerve damage or muscle loss at that thenar eminence. Once those muscles at the base of your thumb start to look thinner, even if you get treatment later, they might not fully come back. That's why early treatment really matters. Let's talk about treatment. What actually works for carpal tunnel syndrome? Well, the first is wrist splinting. This is usually the first thing that doctors will recommend. A wrist splint keeps your wrist straight, especially at night. It prevents your wrist from bending into positions that make your symptoms worse. A lot of people see significant improvement just from consistent nighttime splinting. Activity modification. Reduce whatever repetitive strain is contributing to your symptoms. Take more breaks at work. Adjust your workstation, use ergonomic tools to make sure that your wrist is straight. Anti-inflammatory medications. Ibuprofen and naproxen can help with pain for the short term, but they don't fix the mechanical pressure on that nerve. They're not long-term solutions. Another is steroid injections. A corticosteroid injection into the carpal tunnel can reduce the swelling and inflammation around the nerve. So for some people, this provides relief that lasts for months. You can get up to 3 to 4 per year. It's not a permanent fix, but it can help decrease the inflammation. You can also try physical therapy. Therapists can teach you some nerve gliding exercises, gentle movements that help the nerve move more freely. These can help in very mild cases, but if there's severe compression on that nerve, you probably need a little bit more. That's where surgery comes in. If your symptoms are severe, they are persistent, or you've developed muscle weakness, surgery is usually recommended. The surgery is called a carpal tunnel release. The surgeon cuts the ligament that forms the roof on top of the carpal tunnel. This is called the transverse carpal ligament. This immediately relieves the pressure on that nerve and improves your symptoms. Now, once you remove that constricting band, the nerve is not getting squeezed as much anymore. There are two main approaches to surgery. The first is an open surgery with a small incision near the palm, or an endoscopic surgery with tiny cameras through even smaller incisions. There's less scarring with endoscopic procedure. Both of them do the same thing to just release that transverse carpal ligament. Surgeries are outpatient. You go home the same day. Recovery varies from person to person, but usually your hand will be sore for a few days to a few weeks. Your grip strength can take weeks to months to fully return. The numbness usually improves gradually. If the nerve was compressed for a long time, it can take months, or it might not even fully return if you had permanent nerve damage. That's why I emphasize the importance of early management. But for most people though, surgery works pretty well. And I can't emphasize this enough. The earlier you treat it, the better outcome you get. Can carpal tunnel syndrome come back after surgery? This is very uncommon, but it can happen if scar tissue forms over the carpal tunnel again. But for most people, they do pretty well long term. When should you see a doctor for symptoms that are suspicious for carpal tunnel syndrome? If you have persistent numbness and weakness in your hand, you're starting to drop things regularly, you're noticing that that muscle at the base of your thumb looks kind of thinner than the unaffected side, or you've had symptoms for more than a few weeks despite trying other conservative management like splinting, the anti-inflammatory medications, you need to get evaluated. Early treatment prevents the long-term nerve damage. Can you prevent carpal tunnel syndrome? Not always, especially if you have risk factors like diabetes, thyroid problems, or pregnancy. But you can definitely reduce your risk. Keep your wrist in a neutral position in repetitive tasks. This can be accomplished by wearing a wrist brace. Take frequent breaks at work. Avoid sleeping with your wrist bent. This can also be accomplished with a wrist brace. Maintain a healthy weight. This is easier said than done. And manage your underlying conditions like the thyroid problems, diabetes. Small habits can make a huge difference over time. If your hands are tingling and if you're waking up at night and you have to shake them out to get some feeling, don't ignore it. Get this evaluated early. We have explored the benefits of early evaluation. Most cases of carpal tunnel syndrome will improve with the right approach, whether that's splinting, injections, surgery, and lots more. This video is for educational purposes only. If you're experiencing symptoms that are suspicious for carpal tunnel syndrome, please talk to your healthcare provider ASAP. If this video has helped you understand your condition or your symptoms a lot better, share it with someone who might be dealing with the same thing or the same symptoms. And don't forget to subscribe. In the next video, we're going to be talking about carpal tunnel syndrome, specific questions that people have online. We're going to be diving deep into that very interesting topic. This is Dr. Zikky, helping you understand your body in plain, simple language. See you in the next video.